Good afternoon, and apologies. I was also teaching this afternoon, so in the practice of global health, sprinted over here from the medical center to come in and give this talk on our master's program in biohazard threats and emerging infectious diseases. And I think just to focus on, I've heard multidisciplinary, interdisciplinary approaches throughout the course of, I think, every program and every center, and I think that just goes to show how science and technology, public health, global health security really don't operate in vacuums anymore, and in order to train the next cadre of professionals, we're really working across a number of disciplines. So this master's program is based in the medical center, and one of the things that we really look at focusing on are how infectious diseases, whether they're naturally, accidental, or deliberate in occurrence, affect global health and affect health security. And how we train the next group of professionals in terms of thinking about how, no matter what the source of the agent is and how the event occurs, there are both national and global disciplines and frameworks that apply and can be addressing these global health threats. In terms of program evolution, our program really began based on some of the national threats to health security and based on the Marithax events in 2001, and has really evolved over time. The threats that posed, I think, the biggest risks to health security in the US have evolved. The technologies to advance countermeasures, vaccines, and research have evolved, and so we have really tried in our program to think about how to address both the threat of infectious disease and the types of technologies that are coming into play. Some of the constraints that we have is that threats evolve, diseases evolve. I always tell the students that they picked a great discipline to study. They have good job security and the fact that infectious diseases will always be an issue. But that allows us then to think about how we approach global health in terms of infectious disease threats, biodefense, both in terms of national and global strategies, the threat of bioterrorism, because we do have a health security aspect to our program, emerging technologies, and then their impacts in terms of dual use. One of the opportunities I think this program has in particular, it's one of only a handful of master's programs that focus on biological hazards and emerging infectious disease. We have a very niche program that attracts students from all over the country and actually all over the globe. We have in an average of 20 students a year, at least 3 to 5 are international, which is fantastic. We have a fantastic resource of adjunct professors that are experts in the field, that work in the government, that work in the non-governmental organizations and even think tanks that come and lecture to our students and provide them not only on-the-job exposure of what they could be doing after graduation, but thinking about how the information is churning and turning and the priorities both from a domestic and international perspective. And we also have a fantastic network of alumni that have been exceptionally active in mentoring our current students. In terms of Georgetown's role, I mentioned we're just one of a handful of programs that actually offer a master's degree in biological threats. This is just a breakdown of the last 4 years of our students in graduating, where they were in the next, where they were within 6 months of graduation. So we've got about 50% of our graduates go into government and policy, focusing on emerging technologies and biological threats. There are a number of US agencies that focus on that in particular. We also have a number of students that go into graduate degrees in the last 3 years, MD, PhD, and JDs. Business, biopharma are also polls for our program, as well as consulting and healthcare. So I think we are able to train a group of individuals that really can cross disciplines because of our faculty, because of our topics that we instruct, and we've had some great interactions with faculty within the medical center and on main campus. So thank you.